So do you think social media has somehow incited a feeling that people should look beautiful? Everyone has a certain standard of beauty.
Yes, definitely. Earlier, there were a set of people who were exclusively into show business. But nowadays, everyone shoots their own reels, and most of the meetings happen online. So the way you present yourself definitely matters more these days.
So being a plastic and cosmetic surgeon, what do you think are the most trending procedures that people want today? Or what are the most common patients that you see nowadays?
In the younger age group, definitely enhancement of facial features. Those who are in their middle ages wanted to look much younger to their age, and they come in for anti-aging treatments, and body contouring surgeries are also very much popular. When the problem is cosmetic and has got a significant impact on the child, like some people who have got a deformed nose from birth or something abnormal feature on their face or on their body, and refuse to go to school for that purpose. So I don't think the age should be the criteria, but if you want to set a standard age, 15 and above would be better. If the general health is maintained well, then we can go on to 70s, 80s also.
So I think plastic surgery or cosmetic surgery, although in today's society it's taken as a stigma or people consider it as a taboo or not widely spoken in circles, but somewhere I think it is playing a very important part for those who go through it successfully, that it is it's life changing.
Transforming.
I have some of my friends who had small procedures. So earlier they were not confident enough to give job interviews or talk to people. And after that, they have become like very good speakers. They are acing interviews with top companies.
A small flaw, which any person considers that it's a very small flaw or a deformity in their body, it may have a significant psychological impact on them, and it affects performance. So in this competitive era, where performance matters significantly, and when you have procedures, standardized procedures, these are not just experiments. If it can change your life in a better way, you should definitely go through it.
So very briefly, can you differentiate between what is a plastic surgery and what is a cosmetic surgery?
Plastic surgery is a very wide spectrum, and in which cosmetic surgery is a small part of it. The major chunk of plastic surgery is reconstructive surgery, in which the primary aim is to restore the form and function of any part of the body that has been lost. We also treat burns, and post-burn reconstructions are also a major part of our work.
We have seen people bursting crackers, but let's say there's a guy who has his hand burnt, maybe a cracker burst in his hand. What are the next steps that they should do immediately? And if the burns are of a higher degree, what procedure is suggested, or what is the course of action to go forward with that?
First of all, safety first, not to panic. Whatever is the object causing the burn, the contact should be removed. Immediate first aid, not to put in ice water. The hand should be kept under running tap water or dipped into a bucket of water, at least for 15-20 minutes. And once it settles down, it should be wrapped with a clean cloth. Consultation with a plastic surgeon is important. Even though if it is not of a major degree, all wounds, they heal. But people become more concerned about the scars later on after the wound heals. So the earlier you visit a plastic surgeon, we can help you in getting better scars. For a more severe degree of burn, surgical intervention may be required, so we can help guide you better.
So another very important factor is obesity. What do you think about today's obesity or people who are getting overweight nowadays?
Diet is definitely one. Lack of discipline is the main thing. These fried foods and whatever junk, they are very easily accessible. And you just step out of the home, you see the ads of those only being displayed everywhere. You don't have a choice unless you are consciously deciding that this is to be my diet. Unless you do it that way, we cannot initiate any change.
After 1990s, once earlier when the globalization happened and all the fast food chains started coming in India. So after that, people, like, the rate of growing bellies out or people getting overweight rampantly increased. So one of my friend mentioned that although I think he's around 100 plus kgs in body weight, and he mentioned about liposuction procedure. So we were just casually sitting around, and he asked me that is it safe or not? Who should get it? Who should not get it? Or what is the pre and post procedure precautions that we have to take? So very briefly, if you can just tell us about the liposuction, what happens and how does it go?
There is one very big misconception regarding liposuction. Like your friend was looking for a solution for losing his weight.
Mm-hmm.
And liposuction is not a procedure for weight loss. We have other surgeries like bariatric surgeries, which are intended for weight loss. Liposuction basically is a body contouring surgery.
Mm-hmm.
It will definitely help him after he has lost significant weight through other measures, either by diet, exercise, or some certain drugs and injections, what you get these days, and or bariatric surgery. Once these are done,
Mm-hmm.
so you have all the body parts hanging after losing a significant weight of 30-40 kgs. Once you lose them,
Yeah.
all the body parts begin to sag.
Yeah.
And then the role of a plastic surgeon comes there.
Okay.
Liposuction is definitely required in these people because there are some stubborn areas of body fat
Mm-hmm.
which are not lost
Mhm.
after these surgeries or any weight loss measures.
Mhm.
For contouring and making them more presentable,
Mhm.
liposuction and other excisional procedures definitely help.
We have seen very like motivational stories and reels on Instagram where people are losing 50-60 kgs of weight in a span of few months or 2 months to couple of years, and suddenly they are, when someone who is persistent and they are working very hard to lose weight, so they are losing weight and they are building muscle as well. But in the videos we have seen that their skin and all starts sagging like drastically, and one guy was just tucking his skin inside. So what is the procedure to get over that? Like, what do we do to make it correct there?
See, as I have mentioned that once you lose a significant weight, that is around 25 to 40 kgs, 50 kgs. This we normally see after bariatric surgeries. So yes, once the fat is lost, all the body parts, they begin to sag. And the most obvious areas are the circumferential belly, then you have the arms and you have the thighs. We have excisional procedures which are also called the lift procedures. So there are a set of post-bariatric body contouring surgery procedures help to tighten up, in which all the extra skins is removed and they are shaped.
And what about the scars or the marks?
Yes, scar is a byproduct. You can't help it.
I can understand. That guy talks to me every day that somehow it's creating some kind of hindrance in their everyday life.
See, it's a very basic thing that once you lose that much of weight, you definitely want to wear the clothes of your choice and to show off. Even not show off, you want to feel comfortable.
So is it safe, these surgeries for liposuction or the skin reduction surgeries that we do? Are they generally safe?
They are safe. There are many things that need to be taken into account while planning these surgeries, because people who have got this weight generally have comorbid illness like diabetes, hypertension or cardiac issues even at a very young age. So all this needs to be stabilized, and if necessary, these procedures are staged.
So let's say someone with a comorbidity, they have diabetes or high or low, maybe blood pressure issues. They might be having some excessive cholesterol also in their body. So what is the role of comorbidities in this?
See, like, comorbidities is not a contraindication for surgery, but they need to be stabilized because all our procedures are planned procedures. We are not doing it as an emergency. They need to be taken under control, and then we can plan this procedure.
So I remember that guy when he was 100 plus kg, he said that I want to look like Hrithik Roshan or maybe Tiger Shroff. It's fine if you want to look like your favorite celebrity. So what do you suggest? Let's say there's a guy who wants to look like his favorite celebrity. What are the procedures that they would want to do, or what is the reality behind it? Like, what is achievable?
See, if somebody is asking for 1 or 2 features to be corrected in order to match their favorite celebrities, it is doable. But we cannot transform one person into another through these surgeries. The person undergoing the procedure should be intelligent enough and mentally stable to understand these things before subjecting themselves under the knife.
Yeah.
And they need to have realistic expectations. These are good candidates for surgery, and they are generally happy after undergoing these procedures. So they should understand that you cannot transform one person into another. We can match the features.
Yeah. So, do you think that if the features are matched or they get the desired results also, they'll be happy? But what are the chances that the surgery might go wrong? Or there'll be people who might come to you that maybe after a surgery, a certain thing didn't go well. So, what kind of cases happen that way?
See, normally people who have realistic expectations are generally happy after their surgeries. Only this set of people, and one extreme set who we say have got the body dysmorphic disorder, they are never happy with whatever they undergo. We are performing surgical procedures, and you perform the same procedure in 2 or 3 different individuals, the results are going to be different.
Yeah.
Okay. And when people come in with the AI generated images of themselves, or they ask us for the simulation videos that how will I look after the surgery, it somehow gives one false impression, which we may not be able to generate 100%. The results are definitely better than their previous self, but it may not match the image what they have seen. Such patients are never happy.
Because that is setting the bar very high. See, AI is a totally different world.
Yeah.
You give your face picture to AI and you ask them to make me this, make me that, they'll make you anything.
They can make you anything. But the tissues don't behave that way.
Yeah, the tissues don't behave that way. Even plastic surgery has its own limitations.
Yeah, it has every procedure, surgical and non-surgical, all of them have got their own limitations. And every procedure also have their own set of complications, which are possible. Everyone undergoing surgery or any kind of cosmetic procedure should be aware of those things.
What is the most overrated procedure, do you think, that everyone says कि यार ये तो चलो करा लेते हैं, ये तो करना ही पड़ेगा, but it is not that much necessary?
See, it's again that every procedure has got a limitation. Like when I'm using a particular machine and doing a certain thing, or I'm using a certain drug, or I'm performing a certain surgery, every surgery has got its own limitation. Now, marketing has changed the scenario. Marketing is done in such a way to over-promote certain procedures, showing false results, which the machine or technique cannot produce. So there are a few, like they claim the hydrofacial procedure, for example. One using the original hydrofacial machine or getting it done by an expert will get the results they claim. But now you can see in every salon has got an hydrofacial machine.
Okay.
People in general, they cannot differentiate. So, and these machines cannot deliver those results. Now they blame the procedure. So this is so with so many things. If I have to mention a few other procedures, it is maybe non-surgical facelift procedures with threads.
How does that happen?
We use certain medical grade threads which are inserted into the face, which cause lifting of the face. But they also have got certain limitations. They tend to overpromise, but they cannot deliver results as comparable to surgery.
Going to a wrong place and trusting them with your skin, with your face, that can sometimes react or maybe have a negative effect, right?
I don't know about other places, but now in India, we have seen that you have wide variety of people who practice aesthetics. Now, these are not doctors. All of them, they take a short course of aesthetics and then they claim themselves as cosmetologists and start practicing. Now, their knowledge of aesthetics is limited. They are trained to do the certain procedures and they can handle them well. But the problem comes in when something goes wrong.
Just having knowledge about certain tools and not having creativity is like two poles apart thing. So I would say plastic surgery or beautification or cosmetology as a whole sector, it requires some sense of aesthetic designing inside your brain as well.
See, sense of aesthetics anyone can have. Even an artist has good sense of aesthetics. It's not just that. It is the craftsmanship also. It is the science behind it also.
Yeah.
We spend significant amount of years learning the science behind it. Now, I am not molding a clay. I'm
Yeah.
working on the human body. So I need to know the anatomy and physiology of it too.
Having that skill set or that confidence with the patient, and that transfers to the patients as well. They search for places where they can trust. They can build a confident relationship with the doctor or the person performing surgery on them.
I would rather insist that this is the basic homework what anyone who is contemplating cosmetic surgery has to do. Research properly your surgeons, look for their qualifications, look for their experience, see the center where you're getting operated, and then decide upon your procedures.
Because that way, I think building up trust at one place, because people, when they trust a place, they are more confident, and subconsciously, I think after the surgery, that might impact on their results as well. If someone in their mind is overthinking, or they are thinking ki this can go wrong, there can be side effects, even if it's not happening, then also I think they can feel that ki aisa kuch ho raha hai. Maybe sometimes jaise some actors got a lip filler, but that I think there was some issue, right? What was that case? Without naming the actor, if you can just give us a understanding.
Lip filler is one big business now. So it's trending also. It's quite fashionable. And yes, if it is done properly, it significantly enhances the way you look.
Yeah.
People feel that if I put a little filler, it is good. If I put more of it, it should be more good. But that is not the case.
Yeah.
So generally, clients push us to do more. Judgment about how much of it needs to be given and what suits the patient is very important. So most complications of fillers, I won't say, unhappy results of fillers are mainly because they are being overdone.
Apart from overdone, let's say after someone got a filler and after 2-3 days, can some swelling or some other issue can happen later on?
Later on, means fillers, normally the fillers what we use are hygroscopic substances.
Okay.
So they absorb water and swell a little after the procedure, but it comes back to normal. It takes time to settle down. So we need to give it some time to settle. But when you are doing the procedure, we normally underdo it. And if the patients are not happy with it, we can always add more of it.
Would you say that let's say if someone got a procedure, after 2-3 days they got maybe a overswelling or and that impacts them, because till that time they won't be able to go out or carry on their regular life. So it is fine that it'll take a couple of days and it will subside automatically, right? But if it does not, do we suggest some medication also, or some any other like follow-up procedure, or what happened then?
See, now to avoid this kind of surprises post-procedure, a pre-operative or a pre-procedure consultation with the doctor, whoever is treating, is important, in which you need to understand, means people normally come to us saying that I want fillers done, but they don't ask us, this is my problem. I am not happy with the shape of this. You suggest me what would be the best way to get it corrected. One thing, a proper preoperative consultation where you have to discuss your treatment options. And once you have decided on it, what would be the course of treatment, and every procedure what we do, most of them, even the non-surgical ones, have a certain downtime, means the recovery period. They should prepare themselves for it. If what happens these days is that patients, they consult us on phone and they land in directly for the procedures. Then they forget most of the conversations what we have on during an online consultation. And once you have swelling, bruising, and inability to perform actively in the immediate post-operative period is a common thing. And different surgeries, depending upon how extensive the surgery is, that much is the recovery period. People are usually surprised because they are not prepared for it. And yes, it may be a normal thing, or it may be any surgical complication, which we can identify when you come during post-operative visits.
Let's say someone has decided, maybe we know that Instagram is making people insecure nowadays. So what does people do? They search online that I want to get this thing corrected. Then they search what all places can do that. They create a list out of Google and they randomly start dialing numbers. There's this, hey, I want to get this. What is the price? Hey, I want to get it. What is the price? 10 jagah call karenge and they'll get the price and quotation.
That is the way most people decide the place where to get treated.
Where to get treated. So whatever place they see and which has maybe some good pictures, some good reviews, and the price also suits them. So they just go there ki haan yaar ye kara lete hain. But that does not matter na ki if someone, let's say there are thousands of surgeons or clinics out there, जरूरी नहीं है कि जो टॉप 5 पे ऊपर आ रहे हैं वही अच्छा काम करें. मे बी जो 10th पेज पे हो सकता है वो भी अच्छा काम करता हो.
You can identify them only once you visit and have a word with them. You need to talk to the person who is going to perform the procedure beforehand. This is the most important thing.
A last message that like lot of people are unable to take a decision that we want to get this done, we don't want to get this done. So let's say if someone is having an insecurity about something and they want to take a decision, ki yaar chalo let's go forward with it. So what do you suggest, or what suggestion would you like to give it to them?
I get a lot of patients who come to us asking for breast reduction surgeries. They are significantly troubled. I would not put this under the category of a cosmetic surgery. It's functionally disabling significantly. They cannot wear the clothes of their choice, and it's like carrying a few kgs weight on yourself every time, which you cannot put it down even when you are sleeping.
Even I think that adds a significant amount of load on the back as well.
Yeah,
it causes a lot of back pain also.
Yeah. It's not just the cosmetic problem, but it causes neck pain, back pain, the breast pain also, and impacts their lifestyle very significantly. Many people are not aware that there is a treatment for this.
There is a solution for that.
There's a treatment for this. And some people, even after coming for consultation, once they get to know that the treatment is surgical, they opt out. There is no family support. The spouses are not supporting, or the parents are not supporting. So they find decision making themselves very difficult. See, information is available everywhere. If there is enough support from the family, it's not just financial support, it's a psychological support for a person in 20s or 30s. As an individual, to take a decision of undergoing a cosmetic surgery is not very easy. People who are in pain, they can definitely, if surgery is a treatment, they don't think much. But to take a decision, so the support of the family,
moral support plays I guess a bigger role.
It helps in decision making.
So with the finance involved, I think moral support is also very important. That gives them the confidence to go forward and take that step. And for the patient, talking about the ROI, that they are investing the amount in the surgery or in the procedure, I think the returns on their maybe internal personality, they can be significantly higher there. Because
what confidence does to you is something what you cannot calculate.
Yeah. So it was a good discussion, ma'am. We'll be talking in detail about the surgeries, how to do, what to do. If someone has any specific doubts or any questions, they can ask us, and we would love to help them one-on-one.
Definitely.
All right. Thank you.